Coming up next on Arizona Horizon. Arizona is one of 6 states involved in a new Medicare pilot program that requires pre-approval for some medical procedures. Also tonight, an update on the Arizona Theater Company's Rise Above fundraising campaign. And a local artist partners with the Suns and Mercury for a new mural outside PHX Arena. Those stories and more next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your public television station.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. A controversial new way to administer Medicare is coming to Arizona by way of a pilot program that looks to reduce wasteful and inappropriate services. It's controversial because it calls for pre-approval for select medical treatments. To learn more on this, we welcome Dr. Swapna Reddy. She's Assistant Dean at ASU's College of Health Solutions. Swapna, good to see you again.
Nice to see you.
All right, let's talk about this. This is a Medicare pilot program. Now, pilot programs are like, hey, you want to be involved? Yeah, let's be involved. That's not involved here, is it?
Well, less so. So 6 states have been chosen by the Centers of Medicare and Medicaid Services, and those 6 states include Arizona. We're one of the states that have been chosen for a 6-year pilot program. And what that program will actually entail is that traditional Medicare, so fee-for-service Medicare, traditionally, usually not subject to prior authorization, about 16 services, and that could expand, will be subject to prior authorization, prior approval by the insurer before your healthcare provider or the health system can provide certain services or fill certain prescriptions.
Give us an example of prior authorization.
Yeah, so prior authorization, basically, if you are in the healthcare field, you know it really well. If you are a patient, you may or may not have interacted with it. What it basically states is that your insurance company, your payer, has to approve certain treatments, certain medications, certain processes, not emergency processes, but most healthcare is not an emergency setting, right? Before your provider can know that they will get paid or reimbursed for that treatment. And often what the insurance company is asking is this basically the least expensive way to provide this treatment? Is there a less expensive, less arduous, less extensive way to provide this treatment or get this medication on board?
I want to get back to those questions in a second because it sounds like those are the kind of questions that could bog down a medical practice quite. Well, let's do it. I'll ask it right now. I mean, if you're a doctor dealing with this, this can't be great news.
Yeah, so you might not be surprised that the concept of prior authorization is not particularly popular among physicians, clinicians, healthcare systems. So I'll give you some quick stats. At sort of your average doctor's office around the country, they submit about 40 prior authorization requests a week. They spend about 10 to 12 hours just on prior authorization. That's not just submitting, but that's having conversations with the insurance companies, that's having conversations about appeals, et cetera. And about 25% of all prior authorization requests are denied on the first run.
Wow. Oh, and this prior authorization method, this is used with private Medicare situations. First of all, we hear Medicare Advantage, we hear all sorts of other things. Yes. Explain the process, explain the formula here.
Well, really quickly, Medicare Advantage is an option for Medicare recipients where they can supplement or add on services by purchasing into the private health insurance system. So prior authorization is actually quite common in the Medicare Advantage system. It is really, really rare in the traditional Medicare fee-for-service system. And this particular pilot program is going to be affecting the traditional Medicare system.
Now, I understand AI, machine learning will be used alongside clinical treatments and clinical assessments and these sorts of things. How does that work?
Yeah, so we're learning this every day. We're learning the plans every day. But as it's been stated, basically, if there is a request for particular authorization for one of these 16 types of treatments, there will be some AI algorithm that will be applied. And based on the algorithm, which we're not exactly sure what that algorithm looks like yet, the insurer will decide, or the private contractor that the insurer is working with will decide if that treatment is approved or not. What the insurers have told us is the ultimate decision will not come from the AI formula, but will come from a clinician who will review what the AI recommends.
These 16 conditions, what are some of them, A, and B, why were these chosen?
So a common condition is skin replacements or kind of treatments that have to do with wound management, which tend to be fairly expensive. And there is some evidence that there's some waste associated with the costs associated with wound management, which is very common for Medicare patients, right? Also things like incontinence, nerve management, pain management, et cetera. So these are kind of the types of treatments that are most commonly listed in that list of 16.
But why would nerve and pain management be is that subject to what we've seen in the past, some sort of waste and fraud and such?
Well, according to the experts at CMS and those that have designed this program, they're stating that some of these processes and some of these treatments, there is some evidence that there's high waste for some of these procedures, and those. It's interesting because they haven't necessarily listed all of the procedures where there's high evidence for waste. So we're going to see what it's like for these 16. It's going to start in January, and right now it's scheduled for about 6 months. 6
months or 6 years?
Sorry, 6 years.
6 years.
Yes,
okay.
yes.
It's called the Wasteful and Inappropriate Service Reduction Model. WISER, I think, is what.
Yes.
Okay. Has there been wasteful and inappropriate service out there? Is this in some ways a good thing?
So it really depends who you're talking to, right? If you ask the health insurance industry, the answer will often be, look, there's a history of some waste, there's a history of some abuse, there's a history of some fraud in the healthcare system, and I think that that's somewhat undeniable. And this is an attempt at solving that problem. The evidence kind of shows about 5 to 7% cost kind of savings annually based on prior authorization. Now, if you ask providers and healthcare systems, what their answer will be, well, but we're spending billions of dollars in just the administrative requirements. Around 40% of all doctors' offices have someone hired just to handle prior authorization. So this is a huge administrative challenge, huge administrative cost that often gets passed on to the patient.
And we've also heard from critics of this particular idea and this pilot program, this is a backdoor way to privatizing Medicare. Is there any point in that?
We'll have to see, because again, this is somewhat unprecedented. We generally have not had a system like this or an approach like this, especially with traditional Medicare. We don't really touch traditional Medicare. I mean, something else that's also really interesting is that the companies that will be contracted for the AI review, there is a profit sharing arrangement as well. So at the moment, there's a profit sharing arrangement, so those companies will receive some kind of profit for the waste that they've saved the federal government.
Oh my goodness, so there's a little commission there going on, huh?
As it's stated right now.
Interesting. All right. Is there any opting out for anyone in any way, shape, or form with this?
So as it's stated, providers, clinicians, health systems they need to opt in to this system. But what's really tricky here is that even if you have not opted into the prior authorization process for these 16 processes, there can be a post-review of how you treated said one of the 16 issues, right? And you can still be denied reimbursement if the AI generation and if the review determined that you did not provide the correct treatment or the least expensive treatment.
And I would imagine a post-review would be even more administrative work, would it not?
Well, it would. And remember, when we're talking about these reviews in general, we're not as familiar with the AI reviews, but we generally have other clinicians, independent clinicians that generally work for the insurer or contractors that are reviewing the treatment, reviewing the prescriptions. There's usually conversations between the prescribing physician and the reviewing physician, sometimes not always the most pleasant, and also the administrator at the physician's office or with the healthcare system. It's a process, and you can appeal, but lots of patients don't appeal. And so I think there's a whole navigation to this process.
And last question, real quick, because we're running out of time, but it seems like this is flying awfully low under the radar here. When this kicks in January, are we going to see a hue and cry in February, March, and people are going, wait a minute, what's going on here?
Well, I guess we'll see what the actual effects are. What's really interesting is that The Trump administration has been really proud of the fact that they've actually lessened and streamlined some of the prior authorization requirements around Medicare Advantage. So it was a kind of fascinating decision to institute this new approach just a few months later. So we'll just have to see how this affects patients and the healthcare system.
Dr. Swapna Reddy, ASU College of Health Solutions. Always a pleasure. Thank you.
Thanks for having me.
The COGS has been separated.
That's very dangerous.
There are lots of players who are just moving in. This territory is completely up for grabs.
Total chaos. Oh, they've got him!
Where are the Cubs?
Wednesday night at 7 on Arizona PBS.
We are the explorer species. We took on perilous journeys like no others had to become the only global species. Human journeys on Nova.
Wednesday night at 8 on Arizona PBS.
I'm Gulnaz Khan. In Colombia, the indigenous Tairona people are leading the way and showing what true conservation looks like. Join me on an exclusive journey to the heart of the world.
Wednesday night at 9 on Arizona PBS.
The Arizona Theater Company kicked off a $6 million fundraising campaign earlier this year. The effort is titled Rise Above, and after 6 months, the campaign's raised more than half of its 2-year goal. Matt August is ATC's artistic director, and he joins us now. Good to have you back. Good to see you again.
Nice to see you. Thanks for having me.
All right, ATC's Rise Above campaign, rising above what are we talking about here?
Well, this is a campaign that's designed to sort of take us a little bit beyond what we would normally raise for our annual fund. It's a campaign that's divided into 3 components. One is we're selling naming rights for our various locations and areas of both campuses down in Tucson and at Tempe Center for the Arts. Those are for our sort of high-end donors to sponsor the box office or the theater or the cabaret theater that we have in Tucson. And then the second component is asking audience members to give either a little bit more than they normally give or to give a first-time donation, and that's been really successful. We've over doubled our numbers in first-time donors. And then the third component is, I can't remember the third component right now.
All right, well, we'll
anyway,
get back to it. Maybe it'll come back to you. But
Yeah.
the idea is 2 years, $6 million, and you're already halfway there, more than halfway there.
We're more than halfway there. And fortunately, we have a wonderful foundation, the Hillman Foundation, that has stepped forward, and this is actually the third component of it, who's doing a $300,000 matching grant, 2-for-1 matching grant. So for every dollar or every $2 that is given to us, we will get $1 extra from the Hillman Foundation.
Very good. All right. So when naming rights, have the naming rights for Tempe Center for the Arts and the Temple of Sun, Temple of Music and Art in Tucson?
That's right.
Have they already been granted? Is that still a work in progress?
It's still a work in progress. We have about half of them accounted for already. We've got a handful left to go.
There's a digital giving platform that's involved as well. What's that all about?
Well, that's our atc.org/donate component of our website.
Okay, so that's where the donors can do what they do, maybe push it up a little bit more.
That's right. That's right.
This is a direct response, I would imagine, to the financial pressures that your organization feels, that the performing arts feel in general right now. Is this something that it's just at the pandemic started and you're still kind of dealing with this, or is there something else going on?
No, it's a combination of things, and I think you're right. I mean, the performing arts historically is, we're a mission-driven operation. Financially, we get about half of our revenue from ticket sales, and the other half really comes from donations. And that's the way that the nonprofit organizations in the performing arts has generally always worked. The pandemic certainly did a number on everybody because it completely wiped out programming for almost 2 years. And fortunately, there was a surge right out of the pandemic of government funding and donor support that since then, with the inflation that has happened and the rising cost of materials and the rising cost of the cost of living, as the balance has sort of gone out a little bit, and we need just a bit more of a push in order to really sustain the level of work that we want to be doing.
Talk more about inflationary pressures on the cost of doing business and the cost of just getting everything from set materials to paying salaries, all points in between.
It's all more expensive. Materials are more expensive, labor is more expensive, and frankly, what our staff needs in order to make ends meet has risen beyond what they can really handle. So, you know, we've over the last 3 years, we've given our staff 2 cost of living increases. That takes a certain amount of that puts a lot of pressure on the organization. And as materials have gone up, and particularly with these tariffs, we're looking at things becoming exponentially more expensive.
You mentioned the naming rights. I know the naming rights can be a biggie here, but it is kind of a one-time thing. Once you do the naming rights, it's like getting a tattoo or something. It's there. And or is this a naming rights situation for a certain period of time?
It's a certain period of time, but it is 10 years. So in effect, it is really sort of a one-time whopper. Fortunately, I think what we're asking for these naming rights will get us through the next couple of years, and I think at that point we relook at what we're doing, and hopefully we're on track with ticket sales and that'll take care of any sort of deficit that we're looking at.
And last question here. Give me the elevator pitch here on why theater in general, ATC in particular, is so important that it needs people to donate.
Well, that's a great question. Right now, particularly right now, getting people out of their silos, getting people out of their lonely rooms, getting people off of their computers, getting them off of their phones, and putting everybody together in a room in the dark to have a collective experience where they're being told a story that means something, that has a lot of emotional value, and that has a very entertaining story around it and wonderful production value. That is an experience. They will walk out of that theater connected to everybody around them in ways that they don't even realize. They will start recognizing emotions and expressing themselves in a much deeper way than they do in monosyllabic communications online through their fingers. They will learn to look people in the eyes. They will learn to interact, and they will learn to feel things with each other.
Where can we learn more about the campaign?
At atc.org.
All right, Matt August, Arizona Theater Company. Lots of stuff going on. Congratulations so far on getting past halfway. Good pace, good pacing.
Yep. We're halfway through. We got a year to go, and we're going to get there.
Good to see you.
Thank you very much.
I'm Jeff Bennett. Tonight on the NewsHour, FBI Director Kash Patel spars with lawmakers during a heated hearing on Capitol Hill. That's at 6 on Arizona PBS.
Local artist Antoinette Cawley has a new mural on display. It's at the PHX Arena and features Phoenix Mercury legends along with younger basketball players. Cawley is also involved with the Mercury Mural Mentorship Program, which works to inspire young artists. And joining us now is Antoinette Cawley and one of her mentees, fellow artist Alicia Hidalgo. Good to have you both here. Thank you so much for joining us.
Of course.
Antoinette, we'll start with you. New artwork at PHX, huh?
Oh, yeah. I'm excited about it.
Talk to us about it.
Yeah, so we brought a little color to the city. I worked with the Phoenix Mercury, the Sons Mercury Foundation, Kia, Black Girl, Brown Girl Collective. All of us came together and ran this mentorship program where I worked with 11 girls and women, taught them the business of mural making, and then we actually went and made a mural that I designed.
So you designed the mural and your mentees helped you out a little bit?
Yeah, I taught them how to create it, and so they got to go out there and assist me in this new piece of art for the city.
And Alicia, you were one of the mentees, huh?
Yes, I was.
How'd you get involved with this program?
I actually saw the announcement on Instagram, and you submit your artwork, and then by a certain day you get an email to see if you were chosen or not. And I got that email, and I screamed. And it was probably one of the best things I've ever done for myself. I was so thankful to get mentored by Antoinette. It was amazing.
What did she teach you? What did she show you?
Everything, basics, all the way to the business side of things, of how to go about a mural contract, what goes into making the mural, and what to expect when doing a mural.
Yeah, I want to talk about that business aspect because mentees and mentors, they like to show how to do things and get product done. But the business side's a whole different ballgame.
Oh, yeah. Oh, yeah. We talked a lot about, see, the business side is the piece that a lot of artists don't get. We like to make, but that part of our brain, we don't really tap into as much. I happen to love that part. And so I thought it would be super beneficial to talk about that and bring Mercury reps in to join in on that conversation. And so I talked to the girls about, well, how do you negotiate with a big team like the Mercury or corporation? You know, how do you price your murals? How much should you be charging based on the time of year? Different things like that. So, yeah, that was really beneficial for them.
Yeah, did you get a lot out of that aspect of it?
Yeah, I never knew what it was to make a big mural for a company on the side of a company building. So knowing how all of that went and what went into it, that was really helpful, and that's something I'll now know forever.
I would imagine another lesson is working collaboratively on a major project. These are big murals.
Huge.
Yeah.
Yes. Yeah, that was interesting because I've never had more than 2 assistants at a time. So to have 11 out there at one time, it was incredible. I didn't think we'd all be able to fit in there, but everyone found a flow, a rhythm. Everyone had a part to work on, and I actually got to take more breaks than I'm used to.
But this is kind of a learning process for you, I would imagine, in terms of overseeing people and making sure. Well, look at all these folks. These are all folks on the same mural.
Yeah, yeah. There was a huge learning curve for me, and I was honest with all of the girls about that. I didn't know how it'd work out having 11, 12 of us out there at one time, but it seemed to flow really well.
How did it work for you, Alicia? Because art can be a very solitary endeavor, and this is obviously very collaborative. That's a lot of folks right there. How did it work for you?
That was completely new to me. I do my art to myself in my room, in my zone. So this was very different, but I mean, I'm so proud of how it came out. I really had no issues with anything because everyone knows something different. And I feel like that all just came together perfectly. Everyone taught someone something different that they didn't know. And it was really, really great.
Now the new mural, PHX Arena, we're kind of seeing it right here. Did this replace the Brittany Griner one?
It did, and I thought it was really important that I replaced that one since I created that one. I think just out of respect for what that mural represented. So yeah, we wanted to bring a little bit of color and represent the past, present, and future of the Phoenix Mercury, and display sort of mentorship and what that looks like in the mural.
When it comes to, and Alicia, when it comes to actually the process, I mean, what did you learn about? I mean, is there scaling, all that kind of business?
Yeah, so I forever thought that putting an idea on a wall seemed impossible. Like, you would be there for 2-3 weeks.
Right.
But learning how simple it was to kind of scale it down, use the technology that we now have, being able to take a picture of the thing you want, take a picture of the wall, place it on top of each other, and kind of trace it from your eye. It was really, really easy. It simplified the whole process.
Yeah. Who taught you this? Did you have a mentor?
I did. Okay, so my friend, he goes by Just Created It. Shout out to him. He's an incredible muralist in the city. So I called him when I got my first mural, and I was like, "You got to come help me. I don't know what I'm doing." So that's who taught me, and then I'm passing on what he taught me to them.
Yeah. And this the other one is, what is this? How long will this be here? Does this celebrate a certain event? Because I know the 2024 All-Star Game, the WNBA All-Star Game was part of the mural process.
Yeah, that was last summer, and we did the basketball court for that. But this was just, I proposed it to them kind of out of the blue, and they loved it. So I don't know how long it'll be up, but I did let them know, I think this is a program you should run every year with a different local artist.
Interesting. We're in a different local building?
On the same wall.
On the same wall.
I think they should do it every year. We'll see. We'll see.
Yeah. Alicia, where do you want your art to go from here?
From here, honestly, I have too many ideas to even think of. I feel like this mentorship opened my mind up to things I didn't think was possible. Definitely want to hit up more walls. But honestly, I'm just going to keep going and see wherever, because this opportunity opened so many doors. I don't know what's next, but I'm excited.
What's next for you?
What's next? A lot. I have an artist workshop series kicking off actually this Saturday. You can find info on my website, AntoinetteCauley.com. And I'm preparing for my next solo show in the spring of 26.
Well, congratulations and best of luck, and congratulations on that. You did great work there. And
Thank you.
Continued success.
Thank you.
Alicia and Antoinette, my goodness. All right, thanks for joining us. We appreciate it.
Thanks for having
That's
us.
it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.